So today's session, this workshop, I want to give you a little reminder. It's going to focus on skill building for program evaluation. It's going to focus on teams that may not have dedicated program evaluation staff. So if you're like, am I in the right place? I don't do program evaluation for a living. This is perfect. This is basics. This is where we want you to be. You'll review the importance of outcomes and evaluation, as well as how to develop measurable goals and objectives and select what is truly important to measure. My favorite part is it's not just talking about it. You're going to actually do it. You're going to have practical application, and that workbook is going to help you leave with a plan. You didn't know that you came here to do a little bit of work, but I promise you'll be thankful that you did. So with that, it's my absolute honor to introduce the speakers. This is, my friends, my team. So Jennifer Rolls-Roots is the director of the Caltrin, the California Training Institute, as well as CEBC. And I also am so pleased and grateful to introduce my colleague, Dana Jarzinka, who's also a training coordinator, just like me here at Caltrin. You're in the best hands, and I'm very grateful that they have made some time to discuss this topic. Like I said, when I think of program eval, I think about these two. So Jennifer, Dana, welcome.
Thank you. Thank you, Jess, for introduction. So I will take us away. Let's see, there we go. All right, so Jess introduced you to the idea of both our note-taking slides and also our fillable participant guide. So just to touch on how we're going to use those, it's how you like to use them. If you want to print out the note-taking slides or just follow along with those, you can do that. With the fillable PDF participant guide, same thing. You can have it on your screen and you can be filling it out as you go along. Or if you're old school like me, you could even print it and write on it with a pen, because that's how I operate. But the important thing is that in the upper right-hand corner of each slide, whenever we're working on a workbook page, you will see that little green number in the green circle. So anytime we see that, that's the corresponding workbook page, and we'll try to call it out, but if we don't, you can keep an eye for it there. Okay. All right, so let's get us started. Thank you again for joining us today. So first, as Jess was saying earlier, but in case you came in late, this is very definitely a basics training. We are going to keep things super simple today. This is designed for people who are not program evaluators. Maybe you're with a small agency and you don't have an evaluator, so you've been tasked with doing some. This is to give you, whoever you are, some very basic skills on how to do evaluation. We're also going to focus on program evaluations and objectives, program level, not individual clients, not individual staff, etc. While what we're going to talk about is still relevant to individual level evaluation, it's not going to be our focus. And then also, as Jess said, we really want this workshop to be interactive. So we encourage you to participate, throw stuff in the chat if you've got questions. You're also going to use this time to actually begin an evaluation for your own program or start drafting something. So we are going to have some breakouts where you'll talk with your rest of this cohort. And then obviously, if you need help or have questions at any time, just let us know in the chat. So now let's take a look at what we're going to cover today. Actually, though, we're going to start with a poll. So we're going to start with who's here today. So Jess, if you want to go ahead and launch that, we're going to talk about what your role is in program evaluation. So what I'd like you to do is think about, with the options on your screen, setting program goals, managing program evaluation, collecting data, analyzing data, developing reports, and communicating results. Which ones apply to you? I'll let that go. Thank you. I see lots coming in. And this is what your current role is, not if you know how to do it, what your current role is, what you've been tasked with doing. And thank you, Dana. It's multiple choice. You can pick all that apply. And we've got pretty high participation. No judgment. There you go. I like that. All right. So Jess, why don't we go ahead and end it and we will share results. Great. So we got folks all over the place, and it looks like a lot of people are doing multiple things. And so hopefully there's going to be something for everyone in this presentation. We're going to get started with the basics. So let me go over. I'll go ahead and stop sharing that. And let's talk about what we're going to cover today. So first, why are we even here? Why should you evaluate your program? It may really seem obvious, but let's just talk about the basic reasons. So first, you want to show and know that your program is working. Everyone thinks you're doing something good and you're achieving great results, but evaluation lets you actually show it in a numerical, quantifiable way. So to really demonstrate your outcomes. You also want to identify your strengths and weaknesses, because we all know that our programs are doing some things great and other things not so great. They could be improved. So evaluation is how you identify where you need to make those changes. Also, your funders want it, probably expect it, maybe require it. So if you're getting money for the services, which you likely are, someone is asking you to show, what are you achieving? And then lastly, I would say your families and your clients deserve it. Just like you wouldn't want to go to a medical procedure that you didn't know was successful or effective. We wouldn't want our families or clients to be attending a service that we don't know is actually helping them. So those are a couple basic reasons. If there are others that you're thinking of, other reasons why you're looking for outcomes or looking for program evaluation, feel free to drop those in the chat. We can talk about those too. But ultimately, every program should be doing some sort of outcomes evaluation, some sort of program level evaluation, just to see, where you need help and where you're having success. So when we talk about outcomes, we're actually talking about three things. Outcomes are our key results. This is really what you're achieving. So the first type of outcome is process. This is who, what, when, where. This is the details, the counts, timelines. 30 people will attend the parent cafe. 12 caseworkers will get certified in MI. This is very like widgets and number counts. And then we have outcomes. And I know it sounds bizarre, but that's kind of how we call it. Outcomes, more generally, this is like the knowledge, the attitudes, the behavior change, the actual performance. This could be something like, lowered stress in a parent-child relationship or decreased depression symptoms. This is what you're actually achieving. And then satisfaction is exactly what it sounds like. Are families satisfied? Are they happy with what they're getting? Did they get what they thought they signed up to get when they agreed to this service? Okay, so we're going to talk today about process, outcomes, and satisfaction. Obviously, there are many more types of outcomes. You might hear things like impact, etc. So we're keeping it simple. We're doing these three, okay? Process, outcomes, and satisfaction. And you want to keep these in mind as we continue. We'll come back to these again when we talk about measurement. Right, also setting some ground levels for us here. We're going to talk about goals and objectives. So let's clarify what the differences are, okay? Goals are the big picture. The objectives are the steps you take to accomplish that goal. So in general, goals are broad. They're general intentions. They might be intangible or abstract, and they might be difficult to measure because they're so lofty. Whereas objectives, those are narrow, they're more precise, they're concrete, and really importantly, they're things that you can actually measure. And one of the resources that we have in the guide has a great quote, says that objectives are the stepping stones you pass on the way to reaching your goals. So they're kind of how you get to that final goal. So to get us started, we are going to talk about program goals. When you're setting up a program goal, you want to keep the big picture idea in mind. So it's okay to go big and be really aspirational. So we wanted to give you some examples that we pulled from California programs from both child abuse prevention councils and family resource centers. And so because they're actual goals, some of these might look familiar if you're from any of these agencies. So let's just reflect on these. We have increased community education and awareness about child abuse, including strategies for prevention, intervention, and treatment. Again, a pretty broad goal. And thank you, Jess, for pointing that out. These examples are also on page 3 in your workbook, which you can see from the green circle in the upper right-hand corner. Another one could be improve access for families, ensuring that children receive the services they deserve and need. You can see these are pretty broad, big picture, pretty aspirational. Help vulnerable families access needed services, develop self-sufficiency, and so on. So again, these are goals. They might not be the easiest things to measure, but they say where your program is trying to go. What's the ultimate, destination where you're trying to get to? If other people have examples of their own program goals, you can feel free to drop them in the chat. But if not, we're going to have a chance to develop a goal in just a second. I'm going to go ahead. So our first activity for the day is going to get you to come up with your own program goals. So if your program, wherever you're with, if you're with, Family Resource Center or a community-based organization, if your program already has established goals, you're going to want to pick one of those today to focus on. If you need to track down your program's goals, run out to the website, figure out what those are, dust off your annual report. You'll have a couple minutes to do that coming up. We know that a lot of programs have goals, might not use them very much. And we'll talk about that later when Dana talks about using evaluation in your work. If you're here from a program that really doesn't have goals, or you're just getting started, maybe you don't even know what your goals are, you're going to have a couple minutes to actually develop one today. You're going to pick one, you're going to work on it, we'll use it for the rest of our activities, and then you can bring it back to your team for review. So again, think about what your program is trying to accomplish. It's okay to be really big and really aspirational. Jess, I'm going to turn it over to you.
Wonderful. All right, everyone. So as we said, this is your opportunity to take this idea and start practicing with it. Get some practical application. So on page 3 of your participant guide, if you turn with me to page 3, what you'll see at the very top, there is a section that you can click on and actually type in. What we'd like you to do here is write a goal for your organization or program. As Jennifer said, you might already have established goals somewhere deep in that, on that website of yours. We're going to give you a moment to find that. So if you would please, we're going to do about 3 minutes here to identify what that goal is and then type it into your workbook, because you need that to complete the remainder of today's activities. We're going to use that as our driving example. And I'm telling you, this is a great opportunity for you to get some practical hands-on practice application. So I will keep track, my friends, for 3 minutes. As you find that. And if you're comfortable, as you're looking for that goal, if you'd feel comfortable dropping it into the chat, it's helpful to see what goals look like, sound like. They don't have to be perfect. Drop it into the chat.
That's great. Angie, I love that you shared context, because I think that's so important for all of us to know who's in the room and how it is that, this is a goal that you have. So that's great.
Absolutely. Wonderful. So now that we're coming on just about 30 seconds left, why don't you give me a thumbs up in your reaction if you wrote a goal in your workbook? You don't have to tell me what it is right now, but did you get a chance to put something in your workbook? Wonderful. Great. Great. Thank you. You can also drop that into the chat. Yeah, thanks. That is this will be kind of the launch point for the rest of today's session. You'll have something to work with during the discussion. Thank you all so much for participating in that. That's going to help move the rest of your experience along very smoothly. Jennifer, I'll kick it back to you.
Thanks. So yeah, I'm just going to touch on a couple of these because there's I think we've got such a diverse group of folks that are here. And so I know we're all looking at these. If anyone wants to come off mute and share their goal with the group, that'd be fine. You can go ahead and raise your hand for that. Or I will just go through and read some of these, but I think you can see from kind of scrolling through them, we've definitely got some quite a diverse group here. People who are working at large increasing all supporting all HHS divisions to increase digital efficiency. I see a few people talking about digital access. That's great. We can clearly see some FRCs and CBOs here. Let me just read a couple of these. Deliver a year-long journey for the client that develops awareness. So that's an example of, more of a client focused. And again, everything we're going to talk about is applicable to that. We're going to focus on programs, but that's okay if you want to work at the client level. Improve service provision for our aftercare clients and reduce recidivism. Wonderful. Let's just pick on it. Let's read a couple of these. Direct, control, and monitor their support services to facilitate organizational success. So these are excellent. So you can see that these are all, pretty lofty, really big goals. And so our next step is going to be how do we make these into something that we can actually do something with? There's another one. Connect families to outside resources to support healthy child development. Excellent. I mean, these are all things that we really want to do. No wrong door approach. Love seeing this. Empower children, caregivers, and families. All right. So great job. All right. Perfect. So clearly you guys know how to write a goal. But now let's take it on, because I think for the hardest part for folks is, now what do I do? How do I turn that goal into something that I can evaluate? And that's the next step. And that is objectives. So as we said, goals are the big stuff. Objectives are narrow and measurable. So now that you've set that goal from your program, it's in your workbook. Let's talk about how we get to that goal. So again, objectives are the steps you take to accomplish your goal. And to be the most useful, we want objectives that are SMART: specific, measurable, attainable, relevant, time-bound. You may hear some other meanings for some of those letters, but that's what we're going to go with here. We're going to keep it simple. So let's talk about what each of these are. And on page 4 in your workbook, there's some additional information so you can follow along there. All right. So specific, S. This is the who, what, when, why. This is what needs to happen. So again, being very clear in your objective, what's going on. Measurable. So how will you know if you achieve that objective? Will something decrease? Will something increase? What will be different about participants if the objective is achieved or when it's achieved? Okay, so that's M, and we're going to talk a lot more about measurable in the next section. The A is for attainable. And so this, I think, is, can we as a program actually accomplish this? If your objective is to, end poverty in the world, that's probably not happenable, not going to happen. That's not attainable from one program. So we want to think about how broad we're going. Is it something we can actually accomplish? Is this objective too high, or is it too low? Are you already doing this? So do you have any historical or baseline data so you know kind of where you are right now? Also, attainable means resources. It's great to say we're going to build a website. Do you have the resources to do that? Or can you reasonably obtain those resources? So A is for attainable. You don't want to set yourself up for failure from the very beginning by setting objectives that you really have no practical way of accomplishing. And we're going to talk about kind of the idea of perfect versus good enough later on, because sometimes we know you're going to have to make a compromise. While we'd all love everything to be perfect and really lofty, sometimes, especially in social services, nonprofit, community-based work, we are going to have to make compromises to what's actually attainable and feasible with the resources we have. Relevant, the R for relevant gets to why are we doing this? So this is the one that gets to, does this feed back to our goal? Is there a clear relationship between the objective and the goal? Okay, so that's just kind of a reality check to make sure that it's actually the two go hand in hand. And then lastly, and probably I think the most important, is time bound. How long is it going to take to accomplish this goal? This objective, how long is too long? How long is too short? So you're going to have to think about time in this. And what that does is ensure that you keep moving that you don't kind of stagnate. So you're going to set yourself an objective that you're going to look at in 6 months or 12 weeks or some specific time, so that you're time bound, so that things keep moving and that you don't get stagnant. Okay, so SMART. We're going to look at some examples now of how you would take an objective and make them SMART. So here's a perfect example of a very simple objective. Parents will have better relationships with their children. I saw a lot of FRCs and community-based organizations where it's clear you're working with parents and families. So this might be a simple objective, but the question is it actually SMART? What's it missing? Is it specific? Is it measurable? What do we mean by better relationships? How are we going to do this? So let me show you an example of an objective that's more SMART. So rather than just saying parents will have better relationships with their children, we're going to say something like parents will improve their relationships with their children by participating in weekly facilitated family gatherings over the next 3 months. So we've made it specific. We've made it measurable because we can count if they participated. We have made it attainable. Assuming you already have these gatherings, then that's something that you can do, have people attend them. It's relevant to the types of programs that we're talking about. And then it's time bound. So we're going to say for 3 months, we're going to look, and that's when we're going to see whether there's a change there. Okay. Questions about that? So if you've got questions, go ahead and drop them in the chat. We're going to look at a couple more examples. So let's move on to the next one, but please, if you've got some thoughts or questions, drop them in the chat. And then I know Jess will keep an eye out for me. Okay, so here's another one. Parents will complete weekly group sessions for 12 weeks to complete the parenting education curriculum. Great. It's a good objective, but can we make it better? So is it covering the S? Is it specific? That's pretty specific. Parents will do the weekly group, but is it measurable? So one thing I like to think about is, what does it mean to complete sessions or to attend something? Are you going to attend every single session? Are all the parents going to attend every session? Is that realistic? Okay. So someone has a good question that says, the goal doesn't need to be SMART, but the objective to reach it does. Yes, Chelsea, you've got that completely right. The goal can be lofty and aspirational, and then you're going to put objectives into place that are specific and measurable and obtainable, that are relevant to that goal and help you achieve that goal. So again, steps on the way to achieving that goal. And did we have another question? I know I saw it. Nope. Okay. Thank you, Jess. All right. So let's move on to how we could reword this one to make it smarter. So now we're saying 85% of enrolled parents, so not just parents, but ones who enroll in the program, 85% of those will complete at least 12 sessions, at least 10 sessions out of the 12-week parenting education curricula. So again, it's specific, it's measurable, you can count attendance, it's attainable, okay? That's realistic that they'll attend 10 out of 12, 85% of them. Is it relevant? Most likely, if you're a parent education group, it's relevant to what you're doing. And then it's time bound. It's 12 weeks. We've been very, very specific about that. Okay. All right. Any other questions? Go ahead, drop them in chat. Please feel free. Thank you. All right. So now let's try a couple more examples. And here you're going to use thumbs up and thumbs down. Jess gave you some instructions earlier. So you've got thumbs up in your reaction bar. You have thumbs down. It might be in your frequently used or recently used. And what we're going to have you do this time is, as the example comes up, give it a thumbs up or a thumbs down as to whether or not you think it's a SMART objective. And again, page 4 in your workbook reminds you of what those SMART criteria are. So let's go ahead and look at the first one. Decrease new client wait times by 10% by June 30th, 2024. Do you think this is a SMART objective? And I see some thumbs up, I see some thumbs down. Okay. We'll give folks a second to think about it. Okay. All right. All right. So we did have a few people who said up and down, and I think that's a perfect example of this is a good objective. It covers a lot of stuff. Is it SMART? It's pretty specific. Is it measurable? Can you measure wait times? We're going to talk about how you might do that coming up. Is it attainable? That's a good question. Do you know what your wait time is right now? Do you have baseline data? So that's one that you might have to think about. Can I actually decrease wait times by 10%? I don't know. Each program will have to think about that. Is it relevant? Depending what your program is it time bound? You've put a date there. So for folks who are, who put down like, you know, what would you change? What do you think? How would you reword this to make it better? Are there folks who have, you know, do you have any suggestions? You want to go ahead in the chat? Yep, I see people saying specific wait times for what? Perfect. Mention timeframes. Excellent. So new client wait times. It might be, you know, I know here we're based at a hospital and we use third available appointment. So it's like not the first appointment, but like what's the third one available? How soon can you get someone in that way? So it's whatever your metric is. And attainability is missing. So you might want to start by saying our current wait time is 3 months. And so we're going to add that in. So not just decrease by 10%, but what the current wait time is and what that might look like. So this is a pretty good start, but you can always improve it. So thank you for folks who are putting that in there. Yeah, great.
And Jennifer, we have an excellent question in the chat.
Okay.
What's the difference between an activity and objective? I've seen something that has the goals, the objective, and activities to accomplish the objective. Are activities the thing you do and objectives is the measurable outcome?
Yes. So Angelita, thank you. That's actually a great way to put it. So again, the objective is what you're measuring and looking at, but you have to do something behind the scenes to accomplish that objective. So if it's decreased new client wait times, what are you doing? Are you bringing in, if this is, let's say it's an outpatient mental health clinic, are you bringing in additional clinicians so you can increase capacity? What are you doing? What are your activities, you know, to accomplish that objective? So yes, thank you. Don't be embarrassed to ask. This is basics, guys. So please, if you have a question, please ask it. And if I don't know it, we'll figure it out and get back to you. So no worries. All right. So let's go on to another one. Oh, where did we go there? All right. Increase family satisfaction with our services. Thumbs up, thumbs down. Is this SMART? These are rolling in slower because it's harder to thumbs down, but yeah, you guys have got it. While this is a great objective to start with, it's not very specific. So increase from what? So what is your satisfaction? You don't have a baseline, you got to start somewhere. With our services, is it a particular service? You know, are you just measuring in general? So yeah, there's many things that you could do to this to make it a little bit smarter. All right. Let's do one more. Recruit 2 new members for our advisory board who have lived expertise by January 1st, 2024. What are we thinking? Thumbs up, thumbs down. How does this one look? Okay, I'm seeing thumbs up coming up. Yeah, this one's pretty good. Could you make it more specific, etc.? Yeah, you probably could, but I think that's a pretty good example. All right. I'm going to move us on. Jess, how are we doing on time? We're okay? All right. Thumbs up. Thank you. All right. So let's go on to a couple more examples, and then you're going to have an opportunity to do some of these on your own for the goal that you wrote down earlier. So let's do the first one. Mothers who were smoking, vaping, or using tobacco, gotten more complicated since, you know, as we've had more tobacco products. So mothers who were smoking, vaping, or using tobacco at enrollment are referred to smoking cessation services within 3 months. So for this one, is it specific? Yeah, it's clear on what you want, what you're looking at. Mothers who are using tobacco, smoking, vaping, it's at enrollment, whoever this program is, and what are you going to do? You're referring them. Is it measurable? Probably could be more measurable. Is it all mothers? So there are things that you could change to make it more specific. How soon are they enrolled, referred after enrollment? Is 3 months reasonable? Is it attainable? That's a question. Do you actually have someone to refer them to right now? What's your current rate look like, et cetera, baseline data. And time bound. You do have 3 months. Is that, again, I'd go back to, is that reasonable? Do you want to wait 3 months to refer people? Okay. So let's do another one. And then I'm going to ask, either you can drop some stuff in the chat, or if folks want to be brave, you can raise a hand and come off mute and give us some ideas. So let's do another one. Staff will be trained on cultural competency. What could we add to this, or how could we change this to make it more smart? Again, you can put stuff in chat, or if you'd like to, feel free to raise your hand and I will have Jess call on you and you can come off mute and discuss whatever you're comfortable doing. So we'll give folks a minute. All right, I see people putting stuff in chat. Great.
Hi, Jennifer, this is Angie.
Mhm.
I'll give it a shot.
Great.
So for staff will be trained on cultural competency, would it be to be more specific on the specific culture for their targeted population, and then giving it a time frame of, within the first half of the year, or if they're new hires, within their 90-day of onboarding?
Yeah.
And then relevant to, I guess I already highlighted, specific to the population that they're working for. I'm
Yeah.
just not sure if I hit the measurable piece.
Yeah. Well, let's talk about that. So I think you got it right. You're basically saying, what is cultural competency? That's kind of a generic term. What do we mean? Is there a specific training they all have to take? Is it 100% of staff? By when? By June 30th, 2024? Or is it all new staff will be trained on the blank, blank, blank curricula within the first 90 days? So all those things that you said, and I see some folks in the, in the chat as well, who've put some excellent, I think, very measurable examples in. But I think the key is, like you were saying, you want to make this as specific as you can, so that you're clear on what you're measuring. And then we're going to talk about measurement in a minute. Measurement doesn't have to be super complicated. And so it's basically, if you're providing a training, it's really looking at attendance. So who attended what? If it's a training, do you have a sign-in sheet that they attended? Did they get a certificate like you'll get for attending today, and so on? So we're going to talk more about measurement. And again, we'll try to keep it simple. Let's find the easiest way to measure something. Okay. All right. Thank you, Angie. I appreciate you coming off and sharing. Jess, we have time for one more?
We do.
All right, perfect. Let's do another one of those. Parents will have reduced stress after participating in our parent support group. What do we need to add to this to make it smart? And again, you can throw it in chat, raise your hand, and come off mute. So what do we need to add to that to make it smarter? Parents will have reduced stress after participating in our support group. So we need to make it measurable. How are you going to measure reduced stress? Perfect. We'll get to that in the next section. Other things that you need to achieve. Is it attainable? Yeah. Does your parent support group have, is there something in it that you think is going to help reduce stress? That's a question. Other things, time bound. Great. So how long do they have to attend the parent support group? Oftentimes support groups are kind of ongoing. So are you going to see an effect in 3 weeks or 3 months? All things that are relevant. And again, every program is going to be a little different. So you're going to have to kind of set these policies for yourself. Perfect. So I see some folks have got some great, so I can scroll back up and catch this. Parent stress scores on the parental stress index will decrease at least 5 points between admission and attendance at the 10th parent support group. Jennifer, woohoo, A+ for you. I think that's perfect. So again, it's just making something that is measurable so that you know exactly what you're trying to achieve and how you're going to achieve it. Right. What group of parents? Thank you. So we've got some great comments in here. Yeah, it's how do you make it more specific, more measurable, more clear for your evaluation. All right, so we're going to move us on to another practical application. Jess, take it away.
Great. And this activity will be 2 minutes long. What we're going to do now is we're going to take some time to write an objective for that goal that you created. So you'll want to go back to your page. Let's see, you'll go back to page 3. I would copy and paste that or just type it back in on the top of page 4. So you'll type in your goal so that you remember what it is. And then for the next 2 minutes, you're going to take some time to think through how you can further improve this objective so that it's smart. So what is a SMART objective for the goal you created earlier? Consider what we've covered so far. I'll give you 2 minutes to get started. And of course, if you have any questions, you could drop them in the chat. You can raise your hand.
And I'll just throw in there, sorry, Jess, that if you're working with an existing goal, you actually might already have existing objectives. So if you do, use this worksheet to confirm whether the objective you already have is actually SMART, or if there's ways that it could be improved to make it smarter. Sorry, I cut you off, Jess.
Yeah, that's exactly what I was going to say. And also, just to confirm, it's to write the initial objective in. It doesn't mean you have to fill in the specific measurable rest of that worksheet yet, just the initial objective. Let's capture that. Now that you've had a few moments to do that, we are going to, if you'd advance to the next screen, please, we're going to do a breakout session. This is your opportunity to take what you're learning and really try it out, try it on for size. And remember, this is a basics group. This is intended to be foundational. This is a safe learning environment where we workshop together. So you don't have to get it right the first time. That is expected. So what we're going to do is you're going to have 8 total minutes in a very small group. You'll probably have 2, possibly other people in the breakout with you. What we're going to ask you to do is introduce yourselves because, hey, you might make a friend. You never know. Why don't you introduce yourself and then share your example of the objective that you've created? So we would probably recommend you share maybe your goal and what objective you came with that. Jennifer, would you like them to also talk through that objective as well?
Sure. I think if they want to discuss it with the group, like we found earlier, there are many different ways that you could write an objective. So folks might have some suggestions of different ways you could write it or phrase it so it's clearer. So yeah, share and kind of muddle over it together.
Yeah, I would say in these breakout rooms, if you think of them as work groups, to be a good partner in a work group, you have to be willing to share and receive feedback. So be a good partner, give some feedback, give some encouragement. That's what we're here to do together. Wonderful. And so welcome back, everybody. As you made your way in, if you feel comfortable with it, we'd actually love to see what you came up with. So in the chat, if you would copy and paste that objective that you came up with, we'd love to hear about it. If you would share that into the chat, please. Wonderful. Great. Jennifer, back to you.
Great. Okay, so these are going to scroll by quickly, I have a feeling. So have the PIQA team understand the digital requirements for each division by attending agency meetings and writing a plan of support. I think it's by October 2023. Perfect. Yeah. I have to admit, no clue what a PIQA team is, but you know, so it really doesn't matter. The objective is relevant to you. It's specific, it's measurable. You've got your deliverables, it's time bound. So looks good. Good job, Lori. Anybody else wants to share? I hope it was useful to be able to bounce it off of folks in your group to kind of talk through and think about different ways that you can write objectives. There's no one right way to do it. And as we're going to talk about in a couple of minutes, there's lots of ways to measure. So I'll give it a second if anyone else wants to share. And then if not, we will keep going so we keep us on time. Well, train all continuing services line staff in SPAs 2 and 6 from LA County. As soon as I saw SPA, knew it was LA County, in youth engagement training by December 30th. Perfect. Again, that's very smart. Which staff? Continuing services line staff. Where? Those 2 SPAs. And it's not SPA like I would love to be at right now. It's a different type of SPA, but that's okay. In the youth engagement training by this date. Great. So I see some other ones coming in. Ramona, thanks. Increase school referrals by 25% for this school year. Increase participation, 20 to 30 schools. So great. Excellent. Thanks for sharing. All right. So now we've got a handle on objectives, and everyone has written down a SMART objective that goes along with their goal. So now we're going to dig a little deeper into the M, the measurable piece. Someone was saying, we asked you earlier what you thought of when you heard program evaluation, and someone mentioned lots of data. I think was what one person put. I'm like, yeah, data goes along with evaluation. So there are some major ways that you can measure your objectives. We're going to talk about 5 today. There's tons of different ways, but here's a few. Assessment tools, administrative data, billing data, visit records, and satisfaction surveys. We're going to talk about the pros and cons of those. So first, assessment tools. There are many, many different assessment tools that exist. I know somebody actually mentioned one earlier, a parenting stress tool. So use the chat if you are already using assessment tools in your program, or that maybe you've used them in the past. Feel free to drop those in chat. Give me an example or idea of some of the assessment tools that you've already used in the work that you're doing. What are some of the things that people have used? So we saw a parenting stress measure earlier. Are there others? Or other folks have a history with any assessment tools? Family needs assessment, great. So there's pros and cons of assessment tools. So let's talk about what are the pros. Why is it good to use an assessment tool? First of all, they're already developed. Someone's already done a lot of work to make something that has been tested and is reliable and valid. You're going to want to look for that you're going to know if you use a reliable and valid tool that you're measuring what you think you're measuring. Protective factor survey. Ramona, we love you. We love the protective factor survey. I think that's a great example. And if you work in the ASQ, adult needs and strengths assessment. So great. We've got some examples of tools that are, I think, really relevant. So clearly you've got experience with these. Another nice thing about assessment tools is that they're comparable to other groups or samples, other agencies. So if you've got 3 agencies or 3 different programs that are all using the same measurement, the same assessment tool, it's easier to compare your results across those programs. Okay. But there's some cons or some negatives to using assessment tools. First of all, data. New data has to be collected. Somebody has to take the time and has to be trained on how to fill these out, how to administer them to families or administer them to staff. You know, some of these have a cost. Per piece of paper, per survey you fill out, there might be a cost. How do you analyze it? That's always a question. And it's going to vary for each tool that you consider. Language concerns. Is it appropriate for the population you want to use it with? Is it even available in the languages that you need it for? And I know here in California, we have a lot of populations that have specific language needs. So that's a consideration. And then lastly, people always ask about developing your own tool. And while sometimes that is appropriate, you know, there's definitely concerns about developing your own tool. And that goes back to that idea of reliable and valid. How do you know your tool is really measuring what you think it is? So if you're going to use an assessment tool, I strongly recommend that you use an existing one. Okay, so how do you do that? How do you pick a tool? So first, a specific tool might already have been determined for you. So it could be that whatever program or practice you're using or that you're in, or your funder might have already said, you all need to use the protective factor survey, and you're going to report that information to us. Great. That made that simple. You don't have to pick anything. And a lot of evidence-based practices, EBPs, have specific measures that they require you to use. They could be outcome measures. They could be fidelity measures, which we haven't talked about before, but whole other area of outcome. And so again, it might be determined for you already. What if it's not? What if you have a program and you've got to pick something? Well, we've got some sources to consider. So as Jess mentioned earlier, in addition to being part of Caltrin, I'm also with the CEBC, the California Evidence-Based Clearinghouse. And we actually have an assortment of assessment tools that we've rated and we provide descriptions of. Another great resource is the Friends. I can't think what Friends stands for, but it's a National Resource Center. They, again, have a compendium of tools that you can use. And let me just show you what those look like. And what you'll see here is that, and thank you for pointing out, CBC is free, also paid for through your tax dollars, just like Caltrin. And it looks like I put up the wrong page there. That was not good when I did the screenshot, so that's not the correct one. So we'll just look at Friends, and what you'll see with that one is there's actually a search tool so that you can identify age groups and cost, and you can put in some keywords, etc. The CEBC tools have things like family attributes, mental health, things like that. So again, we're kind of groupings, and the Friends folks actually have a nice search tool. Okay. All right, so that's assessment tools. And there are lots of options. And when you're considering them, you're going to want to think about all those pros and cons that we discussed. Now, other ways to measure objectives. I'm going to use these first three: administrative data, billing data, visit records, as kind of a grouping. So administrative data would be things like attendance, counts, sign-in sheets. Depending on how sophisticated or complicated your program is, your administrative data could look quite different. It could be phone logs. It could be retention rates, referrals in or out, no-shows, how many, rates, etc. So you likely have a fair amount of administrative data. It doesn't have to be in a database, but it's information, it's data. Billing data, that's usually in some sort of electronic or databasey format. And that could be exactly what was billed, where there's specific codes. It's telling you some details about what was actually delivered. What did you bill for? And then lastly, your visit records. So depending on how you deliver your services, you might have detail on what was provided in each visit, whether it's a parent training program, a one-on-one visit with a family, so many different things depending on what your exact program is like. So this is all kind of administrative records. The pros of all that is that it likely already exists. You could start with just even surveying what's already there. What are we already collecting for all these other purposes? The issues with this type of data is that the quality can vary. So we know that depending on who's writing the visit records or who's tracking the administrative data, the quality could be different. Some people might do better visit records than others. It might not be detailed enough for what you need. So it might not be exactly the information you're looking for. And then lastly, you got to figure out how to get that data out of whatever system you currently have. If it's visit records, are they electronic? Are they in some kind of paper? Does anyone transcribe your sign-in sheets and turn it into attendance records, or you get to flip through a bunch of papers to calculate? If you do, that might be fine. But you got to think about the pros and cons of working with those. All right. Satisfaction surveys. What are the pros of those? Well, first, they could be paper, they could be electronic, they could be phone. They could be super simple, thumbs up, thumbs down. Who's been to like a restroom at an airport and it says, on the way out, push this button to tell us how clean the bathroom is? That's a satisfaction survey, really basic. You could do that at the end of a meeting. So got some different ways to gauge satisfaction. So what are the pros? Obviously, with satisfaction, you're hearing directly from the families, from the children and youth. You're asking them about their experiences. But just like with assessment tools, it's new data that's going to have to be collected. And so you're going to want to think about how you're going to do it. Paper, electronic, phone, thumbs up, thumbs down. What's that burden on the families, on your staff? What's the cost? Who's going to analyze it? Is it available in the language? All those questions that we have with assessment tools. You also might want to think about bias. You're only going to hear from families who are still attending your services. What about the folks that already dropped out before you do the satisfaction survey? Do you get any information from them about why they dropped out? And then lastly, we hear this a lot, is a concern that whether families will really be honest. And sometimes if you're getting like straight fives, like everything is amazing, 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 you actually kind of wonder, are families just afraid to say this isn't as good as it could be because they still want to receive your services? So you always want to think about, getting comments from folks, finding different ways to ask questions so that you're sure that people feel confident that it's not going to affect their services. And that's typically why the satisfaction surveys are anonymous, so that you don't have that concern about it being tied back to you. Okay. All right. So when we think about measurement, we also need to think about what you're trying to measure. So before we talked about process, outcomes, and satisfaction. So thinking about what type of measure is best or where it kind of fits with these. If you are looking for process outcomes, typically, so if you're looking for counts, if you're looking for rates, typically things, administrative data, billing data, visit records are going to make the most sense. So you want to look at your objective. So if your objective was, 85% of your staff are going to complete this training by a certain date, that's a process. That's a process outcome, and you're going to use that through, tracking attendance, looking at sign-in sheets, how people did this. If you're looking at outcomes, changing knowledge, attitudes, behaviors, that's usually an assessment tool, because you're really trying to get at what increased, what decreased. And so that's probably some kind of standardized assessment tool. And then lastly, satisfaction is kind of obvious. It's a survey. You're finding out direct information from those people who are getting services. A survey can be many different things. So like we said, it could be thumbs up, thumbs down, really simple. And there are ways to do that. For example, if you're doing virtual services, there's a way at the end of a Zoom meeting to have someone just click thumbs up, thumbs down, and it's anonymous. So there are ways to collect data. But in general, your outcome is going to be related to the type of data that you're going to collect. All right, so let's look at some ways to measure some of the objectives that we touched on before. Keep in mind, just as with writing objectives, there are going to be many different ways to measure the same objective. So when you're coming up with measurements, I like to remind people first to keep it simple. I mentioned earlier that there's perfect and then there's good enough. And I often, when I'm working with people, especially under my CEBC hat, it's like we all want perfect. We all want the best possible measurement, but sometimes it's not feasible. And so depending on your situation, you might have to pick something that's less than perfect because it fits your budget, it fits your time constraints, it fits your community needs. And that's okay, because doing something, evaluation at some level, is better than not doing anything at all. So don't be concerned if it's not completely perfect from the beginning. All right, so this first example, we saw this earlier, recruiting advisory board members. So in the chat, go ahead and tell me, how would you measure this objective? Recruit 2 new members for our advisory board who have lived expertise by January 1st, 2024. How would you measure that? Let's give folks a second to drop something in the chat. If this was your objective, how would you tell if that objective was met? What would be a measurement for that? Don't overthink this. Perfect attendance at board meetings. Exactly. Any other ideas? We'll give folks a minute to write. So again, don't overthink it. How would you tell if you had 2 new members? So I think this is definitely an example of where administrative data is your best option. Okay, you're looking for records. So here's a couple things. Administrative data. Advisory board rosters might be an option. What's the current roster? What were the minutes with the attendance records? Could you simply email the meeting chair or the secretary and say, When did these two people start attending? Great. It may seem kind of silly, but if you have an objective, you want to have a way to measure it so that you can check it off and you met that objective. Let's take a look at another one. Again, let's use the chat for suggestions of how you might measure this. So here we've got 95% of families attending our parenting program will report being satisfied or very satisfied with services after the 5th group session. Okay. So how could you measure this? What are you going to do? Satisfaction survey? Any other ideas? Other thoughts? Thinking about some of the stuff that we said earlier. How could you, yes, a satisfaction survey. Are there different ways? Exit poll, thumbs up, thumbs down. I think I've beaten that into you. Yep. So let's take a look. Could be an anonymous paper survey during the 5th session. It could be a web survey that gets sent to everyone via email or text after the 5th session. It could be a Zoom poll for virtual groups. And I saw someone who had attendance. Maybe they deleted it, but we're going to come back to that and talk about that's a perfect example of perfect versus good enough. And sometimes if you can't do a survey in any way, shape, or form, you might think of another way to measure it. So we're going to come back to that later. All right, let's do one more. How would you measure this one? So go ahead and enter in the chat. 90% of parents will report reduced stress after participating in 6 sessions of our parent support group. Again, what might this look like? How would you measure reduced stress in parents? Give that a second. A pre-post survey, exactly. So you can start with at the very beginning when parents were coming in, what did it look like? Again, this is an assessment tool. You're looking for increase, decrease. So this is probably going to be an assessment tool. You're going to want to consider which tool fits your needs best. If there's not one that was specified by whatever the parent support curricula is that you're using or by your funder, you're going to want to think about item length, languages, cost, available support for using it, et cetera. All these things. But here's a couple of examples: parenting stress index, parental stress scale, parenting sense of competence. So all different things that are available. And if you go to either one of those websites we showed you earlier and look for parent stress, there's going to be multiple choices there that you can use. Okay. So now we are going to give you a chance to think about ways that you're going to measure your SMART objective. Before we do that, I just want to see if there are any questions that folks have before we begin. If there are, you can either drop it in chat or raise hand and come on off mute.
I'm not seeing any questions in the chat. So this is what we'll do. Now that you've had a chance to consider how would you measure an objective, I'm going to ask you to go to page 7 of your workbook. Go ahead and go to page 7 of your workbook. And here's what I know. If we have too much time, we tend to overthink it, right? So why don't you just quickly jot down 3 things that just come to mind for you as you think about how you might measure a SMART objective. I personally hope a thumbs up, thumbs down exit survey would apply to your objective because I think those are so fun, but it might not. So I'm going to ask, what might be 3 ways? Just take some notes. You're going to talk about it with some friends here in a moment. Just 1 second to think about that. What might be 3 ways? So you'll enter under measurement 1, enter under measurement 2, enter under measurement 3. 3 ways. Give you a couple more moments to think about that. You might consider some of the examples, or I would also advise, why don't you use maybe your page 6 of your workbook? You just took notes about the pros and cons. That might be a good reference point for you as well.
Mm-hmm. Yeah,
now,
because considering your pros and cons is great, because that might help you think about, you know, the ideal way to do it is this, but here's another way I could do it if that way is not possible.
That's right. So it might seem, like you're thinking through it, but that's why we have friends. So if you'd advance me to the next screen, please. We're going to do a quick breakout activity. This will be 5 minutes to talk with just a few other people about what measurements did you come up with? Share what your objective is. What came to mind for you? And if you have the time to think through what the pro and cons might be for that, what a wonderful time to think that out with somebody. So we're kind of putting some application behind what you're learning here with that. 5 quick minutes. You'll be with a few other people. And I'm going to ask you to share, again, your objective and what 3 measurements came to mind. And again, if you want to be a good partner in a work group, you give suggestions and you take feedback. Welcome back, everybody. Good job. Good job. Okay. So you had a moment to consider your objective. Consider how that might be measured. What could that possibly look like? And talk it out with some of your friends. We're just so curious in the chat, or you're welcome to raise your hand. We'd love to hear if anyone had the opportunity to come up with a measurement. So we'd love to hear what the objective is and maybe one way that you thought it could be measured. Do we have any volunteers? You could raise your hand, drop it into the chat. We'd love to hear it.
I can go
Great.
briefly. Let me
Sure.
see. So I think I said earlier what my initial overarching goal was, which was to increase, what did I put? I'm trying to scroll down. Increase authentic youth engagement and youth voice in design and service delivery and child welfare through empowerment and partnership. So I said in thinking about that in the initial objective, which was to train all continuing services staff, which was in the chat. I'm not going to get into all that. So I was thinking about both the overarching goal in one of the initial objectives, because I was also thinking that when we train these staff, we can have attendance data. So that would be one way, but also like to look for a self-efficacy scale, like where are they with feeling that they can engage, these youth, how confident are they before the training and then after the training, and doing some kind of survey there, at the end of the training. And then lastly, develop a survey for the actual youth on how they felt engaged, after interactions with these staff who had received the training. So those were just 3 things that I was thinking about that we could implement.
That's awesome. Thank you so much for sharing that, Ramona. And one thing we do want to mention for anyone that did run out of time, this is not the only time you could think about it, the only time you could address it. This is the beginning of a conversation that we hope will continue after this session. So thank you so much. Thank you so much for sharing in the chat as well. That's great. All right. With that, I'd love to introduce your next presenter, Dana, who's going to talk a little bit about building evaluation into your work.
Great. Thanks, Jess. So you feel like you've just done the hard work for the last hour and a half of really figuring out what are objectives, how do we measure them? And we're going to kind of switch sides of your brain now and talk about how you actually build this into your work. So we've kind of done that lift of why is it important? We've worked through some basics. And now we really have to think about how to balance evaluation with all of those other hats that you've said you wear, because this is just one piece of what you do. So the first thing is we're going to do a couple of polls, super quick little lightning polls to look at what you are currently doing. Jess, do you want to start us off with the first one? So this is, are you currently conducting any evaluation?
Okay, I could see those comments coming in. We have about 80% participation. I can end this poll if you're okay with that.
Yep.
Okay, and here are the results.
Perfect. This is really similar. So you'll remember maybe that we asked you a question similar to this in the registration. This way we're just gauging who's actually in the room for training today. And one thing that makes me happy is the number of people who are not sure has gone down by a little bit, but it's still holding there right around 20%. And we're going to talk about that when we get to communication in a minute. All right, let's do one more poll, Jess. And this one is on satisfaction surveys. Sorry, no, this one is on process outcomes and satisfaction. So you can select more than one here. So now that you know the types of outcomes, what are you doing now?
All right, and it looks like we have the results coming in. And as a reminder, you can select more than one. It is multiple choice.
And this one is going to be really interesting, it looks like.
Great. So I'll go ahead and end this poll and share the results.
Awesome. So it looks like we have a lot of people who are using outcome and satisfaction measures. About half of you are using process measures, which is really interesting. I think after the training today, as you go back, we're going to give you some next steps, especially as you look at those pros and cons for each of these. I think this gives you an opportunity. You saw the exercise you just did was to pick 3 ways. And that's good. We're going to talk about sort of the resource dependency of those measures as we get into this now. And you can go back when you have that time to look on page 2 in your workbook for what's included in each of those outcome types. All right. So starting from scratch. If you are starting from scratch, how do you get started? I would say the first thing you're looking at is who should be involved. Right? If you are a large organization, you might be looking beyond leadership and direct staff. You might be looking at clinical supervisors if you have clinical services. You might even have somebody who has a role in quality or who has a role in training. Those are all people that you're going to involve. If you're a smaller organization, it might literally be 1 or 2 people initially. This is going to be determined by program size, workload, resources. And so the thing you're really going to want to focus on here is it's better to have literally 1 person working on program evaluation than not doing it at all. So if you do not have a lot of resources, you're going to look at what's the minimum number of people that I could have working on this and still have a program. The other thing, and then I'm going to continue talking about this throughout my portion of the training, is for program evaluation, the key thing truly is consistency. And so defining who will be involved at each stage and how they'll be involved is important to long-term success. And that may change over time, but having that clarity and that transparency with your team is going to be very important. So the next thing to look at, especially as you're sort of scratching your head going, well, okay, how do I pay for that? Is look at what your funder requires. And I know that seems really intuitive, but take that time to go back to your statement of work or to your grant proposal requirements. Or if you're a service that provides an EBP, to your EBP requirements, and look at specifically, are there specific measurements that are required? Are there certain outcomes that are being requested by the funder? And those are things, 1, that you definitely need to carve out to have in your evaluation program, but 2, that there ought to be spelled out as part of those requirements, the resources that would do that function. And so that's a great place to start. And then looking at how big to go. Building a program evaluation program is similar to building other good practices or habits, right? If you just say to yourself, I'm going to start running tomorrow. I'm not going to start running tomorrow. But if you were to start running tomorrow, you would not say, by the end of next week, I'm going to run a 5K. In the same way with program evaluation, you're probably not going to build out 20 goals and objectives in the next quarter. So if you're a small program or you're just getting started, you literally need 1 goal and maybe 1 or 2 objectives to work towards that goal. That's a program evaluation program. And so, but again, the key to that program evaluation program is consistency. And so putting that goal in place and putting those objectives in place, making sure the team knows about them, and then consistently collecting data in the same way, and then consistently using that data, which is what we're going to talk about. And then finally communicating that data both internally and externally. And so we're going to move to the next slide. But what we're really going to focus on is how program evaluation actually isn't just about data. So one of the things that was striking is you all registered for this training, which means you have an interest in program evaluation. But about 20% of you were unsure if you were measuring client outcomes. And so one of the things that we really need to look at are a couple of questions around whether program evaluation is being built well into your work and into the work of your team. So if you're already doing some evaluation, we're looking at what are your goals and SMART objectives, which we've covered today, what you're currently collecting. Are you using the data that you're currently collecting? So here's a key thing. Don't ask for data just because you've always asked for it. If you don't need it, you can stop asking for it. Now, the caveat to that is you might not need it for program evaluation. If you're asking for data, for example, for the sake of case or treatment planning for specific families, or for creating and measuring family-centered goals, you obviously need to keep doing that. But if you have an intake form that's 6 pages long and you're not using any of that data, this is your opportunity to actually save yourself some time and save your client some time to go back and really look at that. Are we using this data? Okay, so can you streamline existing forms? What can you stop measuring? I feel like this is a question we don't ask that often. We're consistently asking what else can we measure? And we don't always do a good job of saying, is this useful? So it's that R, right? Is it relevant? Is this data we're asking for? Does it roll up to any of these objectives? If it doesn't, you might want to scrap it. Okay, so again, we're going to have this consistent message of pick objectives and measurements that fit your capacity. So the key to that is really looking at what kind of outcomes measures you're looking at. In this particular example we have, 95% of families attending our parenting program will report being satisfied or very satisfied with services after the 5th group session. We could use a satisfaction survey. They are the ideal method of data collection in this case, but they require effort to administer and analyze. And if you're resource limited, you might want to look at other ways. So you could change your objective to a process outcome for now, because the data might be more readily available. And then you could plan for a survey down the road in the next quarter, in the next year, as you build some more data and determine, is this really useful? How are we using this? So in this objective, we're using a satisfaction survey, but let's think about what's required. You need someone to collect the surveys, or you need some technology to collect the surveys. So like an app, for example, or a service. You might need someone to follow up with families to ensure you're getting a decent response rate. And even once you've done all that, you're probably going to need somebody to pull out the data and look at that. Well, is it very satisfied? Is it satisfied? We need to combine it in a spreadsheet. So there's a lot of time that goes into that. What if you said, I don't have the people to do that? What if you decided that you were going to make that a little bit easier and say 80% of families who start our parenting program will attend at least 5 sessions? Does this still, so this is not a satisfaction measure, right? What kind of measure is this? Does anybody remember? The first one is clearly, it's right in there, right? I'm satisfied, very satisfied. That's a satisfaction measure. Process, thanks, Chelsea. This is a process measure, but does it still measure satisfaction? What do you think? Does anybody think this still measures satisfaction?
No.
Why not?
I mean, it just says that they're going to attend. It doesn't say whether or not what their experience was from attending. You know,
So
will attend this, so they attended. Does it mean that, you know?
they were satisfied.
Exactly. There's no indication that they're going to be satisfied or not.
So this might be a case of perfect versus good. Perfect is everybody came and did surveys and told you it was great. Good might be Your goal was to have 80% of families who start our parenting program attend at least 5 sessions. And let's say you actually accomplished that. 80% of people attended at least 5 sessions. That means of the people you wanted to be there, nobody dropped out. Do you know for certain they were satisfied? No, but they kept coming. So that might be a case of good enough if you're resource limited. This is a case where attendance isn't the perfect measure for this, but it might, assuming they're not mandated to do it, be a proxy for satisfaction. Because frankly, parents are busy, and if they don't like your program or they don't think it's working, they're going to take themselves out of it. And so this might be a case of, is it the best measure? No. But is attendance way easier than measuring satisfaction? It is, because you're literally just checking the rosters. So let me see here. Data we collect. I think about the amounts of time that you spend even just giving data in your own life. And then think about the types of data that we ask for day to day, those intake forms, surveys. We ask people for a lot of data. If you're not using the data, it's not a program evaluation program. You're just asking for data. So, yep. So Jennifer has actually said, start with the process measure, move to the satisfaction measure. Yes. So you have all this data. How you process data is also very capacity dependent. It's possible, if you're joining us from a large county that's really well resourced, that you have a quality improvement department. They all have master's degrees. Maybe even you've got a PhD on staff. They've got great Excel skills. Maybe you've got SPSS running in the background. That's amazing. It's equally possible that you're working with a team that might raise their hand and be like, Excel terrifies me, and I'm not really sure what to do with this data. You really need to know your team and make some decisions about how you're going to use data. So some tools come with a database. They come with training on how to use it, and they come with support. A really great example is that protective factor survey that was mentioned earlier through Friends. It's like a built-in tool. There's training. We've even got some training on it. Another example of how you might collect data would be using Excel or similar spreadsheets. Use really basic formulas where you can so that it's not easy to break things, right? Really think about creating a template so that you can figure out which staff are going to enter that data. The person who sets up your template might not be the same person who does the data entry. You really need to think about what the skills are on your team. And this is one where we like to joke that Google can help you. There are a lot of templates out there. There are also a lot of quick tutorials on, I want to do this in Excel. And you'll really find, here's the formula to use, for example, or here's the workaround for this. Survey apps are another one. Maybe you've been doing paper and pencil surveys for years and years and years. It's time to look at any number of the companies that offer survey apps. For smaller programs, oftentimes the lowest level of service, which is typically free, is going to get you started. And then you can build from there because you start to realize the capabilities that would be helpful to your program. But you don't have to go all in on something really expensive. Yep, so Jennifer's pointing out a couple of the companies that you can look at. We use all of these in different capacities at Caltrin, but you don't have to make a major financial investment in these right away. Finally, pen and paper. If you have a small program, these might be chart reviews, right? If you're clinical, you're auditing SOAP notes, you're looking at sign-in sheets, that kind of thing. And then the other key piece here on this slide is review the data. And that seems really obvious, but a lot of times what we're doing is getting really caught up in how are we collecting it? And then we're not necessarily taking the time to review it. And really think critically about what that data is telling you and then what to do next. So it's really critical when you think about a program evaluation program, you have to concretely build that step into your process. So a couple of things you're looking at is who is responsible for processing the data? Name that person. And again, that might not be the same person who builds the template or decides on the technology. This is literally who's responsible for processing it. How often will they do it? After every cycle of a 6-week program, monthly on a certain day, quarterly. You only have a couple of things, you're going to do it once a year. Actually decide how often will that be. And then this sounds funny, but is there a process for processing the data? This could be a simple tip sheet, but that means that when your person who processes the data decides to go on vacation, it still happens in the same way every time. And then who will review the data? Might not be the same person who collects it and processes it. And it might be a group of people. A couple of questions you might ask here. So this could be, looking at a couple of examples, a quick review by one person, basically a dashboard, if you will. Are we on track with our objectives? Is the data going the right direction? There might be no further action if it is. But if you're seeing red numbers, it might trigger additional action or review, and you might have that in your process. If our objective is going the wrong direction, do I need to bring it to a team meeting? Do I need to work with a specific group of clinicians? What do I need to do? This could also be something that you literally schedule monthly or annually or quarterly, where you put a meeting on your calendar and say, we're going to review either all of the objectives or a certain set of the objectives on a routine basis. So this is something that is essentially a step in the process that cannot be skipped. Okay, let's talk about challenges. You've worked through objectives, you've worked through measurement. You know that you need a process, but you're also here, which means either you're just starting out or you know that you need some improvement in your program. What are the challenges that you face in program evaluation? Either specific to your program or in general that you know are out there. What challenges do you face when adding or improving program evaluation? And you can just put those in the chat. Do any of you who work with teams ever think, do you ever hear what I do can't be measured? Not having a person dedicated it, not having the process defined. Yep, how to measure, people who think it can't be measured. Interesting, Nelson, too much data. Kind of really cutting through to figure out what you need. Too many surveys too often. Yeah, these are really great. We actually came up with a list as a team and you're covering them and more here. Deadlines not being followed, late responses. And that's again, that limited resource capacity. Do you actually have the capacity to follow up with respondents? Yeah, so our list pretty much matches what you guys said. We've got, you can't measure what we do. And I don't see a lot of that here, which is great. We tend to tell people to really focus on what can be measured and looking for those proxies where you can. Too much paperwork. We've clearly got some of that here, where it's too many surveys, too much data for both staff and for families. So this comes back to some of the things Jennifer talked about. Use shorter measures. Don't ask for everything in one visit. Think about where technology can make life easier for you and for families, or at least more pleasant, right? It'd be nice if we had that bathroom easy button. Paying for time. Again, funders should be allocating time for this. Looking at how to make it easier. So here we got, how do we help the team become excited about collecting data, entering data? Ooh, we're gonna get there, actually. Hold that thought. No data skills is another one. I don't have somebody on my team who can do this. So one, really go back to the exercise of, are there different ways I can measure this? How can I simplify? But two, lean on your partnerships. This is a place where we've been talking about community partnership a lot lately. Think about, do you have a relationship with a university locally? Do you have a relationship with a school of social work? Even in some cases, you have a relationship with a high school that does year-long internship experiences with technology. Because a lot of times this is a case of putting somebody dedicated to do a process consistently and routinely, who is not necessarily 100% familiar with what you need in Excel, but who is comfortable, for example, in a spreadsheet and willing to pick up those skills. I love it. Ask board members if they can help or know someone who can. Yes, exactly. And then one other thing that isn't highlighted in these comments, but we really thought was important as a team, is to really check the relevance of measures to your goals and to your target population. And so, and this comes back to that R, relevance, and A, attainable, but looking at making sure that your measures are culturally and linguistically appropriate. So if you decide to use specific evidence-based tools for measurement, are they designed for your population? Are your surveys worded in a way that makes sense specifically for your population, for example? And this is actually a place where getting board members, parent partners, lived experts who are engaged in your program involved to really look at that part of SMART to make sure this works for your population. So the next thing we are going to do is take just a couple of minutes on page 8 of your workbook. And I actually think there are so many really good things in the chat here. The question here is, what do you see as the challenges to adding or improving evaluation at your agency? In addition to what you thought of, there are some really good things to stop and think about in the chat here. And so I would take just a couple of moments to sort of jot down some notes on what are those roadblocks to your next steps that you can see that you identified, or that now that you read those comments, you're like, oh, yep, that's going to be us too. And then for us at Caltrin, we're very application based. What do you think you could do about it? What might be the solutions to that? And once we've done that, we're going to talk a little bit about the last piece of program evaluation, which is communicating results. And we're going to come back to Angelita's comment. But take a couple of minutes, about 3, and sort of just make some notes about what you want to do on those challenges. All right, when everyone is ready, as you're wrapping up your notes, let's get out those thumbs up, thumbs down again. Do you communicate evaluation data to staff on a regular basis? What do you think? It's about evenly split, more thumbs up. Bunch of thumbs down. Let's see a few more. So at the site level, yes, okay. All right, how many people aren't really sure? Okay. So building program evaluation into your work means thinking about how to make that part of your team culture, which is valuable because it signals to your staff that everyone is accountable. Everyone has a clear impact on program success, and that leadership is accountable for results. Program evaluation is a way to clearly, it is essentially a communication tool, both externally. I think a lot of times we think about program evaluation as something we do for our funder, or we do to prove success to the community. But really, program evaluation is also a communication tool internally. It's important to get staff buy-in by sharing evaluation results with them. We know that. And we know that they need to see the value of what they're collecting. This could be, if you're already doing program evaluation, this could be your most important area of focus at this point. This might be where you're improving. So a couple of questions. Do staff clearly understand why you are measuring and what you're measuring? And as you think that through, if you have it clear in your brain, oh, this is why we're doing it, have you explicitly connected how their work impacts the objectives and broader goals? So both with an individual employee and with teams. And then really think about, where does this happen? So we can talk about some opportunities. So I'm seeing some yeses, which is great. So as you kind of take some notes, think through, is this happening at hiring and onboarding? This should be the first place that people are seeing your program evaluation program. New staff and current staff should all know where to go to find this info. This is essentially part of communicating what your culture looks like and helps staff very quickly understand your why, but also your how, right? Like, you get really excited about the why of a program, but this concretely tells people how we're going to get that done and how they're a part of that. Internal staff newsletters. This is a nice way to build that consistency. Designate a section to report results. This could be as very simple as a monthly or quarterly table or a visual, like an infographic, for key objectives. This conveys that this is actually important and puts it in front of people again and again, building that transparency. Staff meetings. Again, another opportunity to build into that agenda with a brief update on results. It's also, importantly, and we've seen this in the comment, a place where you can get feedback. So it's really great if things are going well, but if you see that you're not meeting your objectives, this is a time to say, hey, as a team, what do we think is going to move the marker? Staff meetings are also a great place to celebrate success. This is another key part of program. When you talk about the program evaluation program, we get really stuck on that data. But if you are meeting your objectives, this is a great place to recognize your team. Because we always say, right, praise should be specific. It's literally the S in SMART. You can tell people exactly what they did, and that feels great. Jess is over here laughing. She's in HR. She's like, yes. Another place that you can really think about reiterating the use of these objectives is service plan development. So you have those conversations. What do we want to do as a team? How are we going to create or design this service or improve it? Don't forget to use the data. A lot of times we get really innovative and creative, and that's exciting, but make sure that if you're collecting all of this data, you're building on it, you're using it. And then I know some people came to training really thinking about goals and objectives from a professional or individual level. The final way that you might use this, and there are a lot of other ways, but the ones we want to hit today, is then thinking about, if you're meeting one-on-one with employees and you're saying, well, what, that scary conversation, right? What are your goals this year? How does it roll up to these objectives and these goals, right? So if you're an individual employee, it basically gives you a framework as a leader to really talk to that person about how their work fits with what you're doing as a team. A few key takeaways. I'm going to say it again. You're going to be like, wow, she said that a lot. Be clear, be concise, be consistent. If you yourself needed to hunt around to find your team's objectives for this training, or you're still not sure what they are, this is the area that needs work, communication. Because if you have great objectives and you have great measurements and nobody knows about them, it's not useful. This is where you help staff understand how their work contributes to success. And you want to have those discussions like any type of evaluation process, ideally not just once a year, right? Once a year is great, but you probably want to do it more often than that. We're going to run over, Jess, aren't we?
That is all right. If anyone needs to scoot, we do have that survey, but we can continue. And then of course, this will be provided in the recording.
I've got about 5 minutes worth of data or information. If you can stay, great. If you can't, we totally understand, and you'll have everything in your participant workbook and your notes. And we ask for a little bit of grace. This is the first time we've done this training, so we are just off a twig. Okay, external communication. I'm going to be super quick. This is looking at program-wide results. And the good news here is you all, during our pretest, already knew this. You basically said this is for communicating with funders, it's for communicating with external stakeholders, it's for communicating with clients. One of the things that we wanted to highlight is annual reports. People get really spooked by them because you see this image of like big glossy 30-page printed book. It doesn't have to be that. In fact, we're going to drop our one pager as an example. You can literally do a 1-page annual report. And you'll see in the Caltrin project review, that link did not drop. I don't know why.
I got it. I'm good.
You'll see in this that we actually can build in things like process outcomes, attendance, outcomes, the pre-post knowledge check that you do in every registration for Caltrin, and satisfaction into literally a 1-page document. So it doesn't have to be complicated. We are going to provide in your workbook on page 10, a resource page. And one of the things we want you to find there is a couple of really great resources on data visualization. And the concept in data visualization is basically how you represent data and how you choose the graphics, the charts, how you communicate the information specific to your audience, even down to the color that you're using to make it simpler for people to read and understand. Data visualization could be an entire training. If you want that, stick it in our evaluation at the end of this. But on page 10, we have 3 or 4 really great resources. You can really get into this. It's a fascinating subject. Finally, though, here are our big takeaways for today. Keep it simple. You do not need a PhD to do this. Something is better than nothing. Do not collect data if you're not going to use it. Nobody likes that. There are many different ways to measure an objective. And you need to use your data and report results to drive change if change is needed. So don't let that data get dusty. Actually analyze it and use it. So next steps, review where your program is today. We've actually, at the end of your participant workbook, provided a very quick and dirty organizational assessment. You can do it on your own. You can bring it to your team. It's literally check, we're doing this, but boy, I could use some work, or ooh, nope, we're not doing this. Focus your efforts on this could use some work, or nope. So start there. I also want to note before we leave today that the California Evidence-Based Clearinghouse, our partner grant, provides some technical assistance for program evaluation. You can also find them on that resources sheet in your participant guide. Cruise around the website, also drop them a line. They're happy to work with you individually as a program on your program evaluation questions. This has gone very quickly for us. We've had a great time with you this afternoon. We hope you found it useful, and I'm going to turn it over to Jess to close us out.
Thank you. On behalf of those on the call, we just want to say thank you. And the information was so informative. I feel like for you participants, I hope you enjoyed having an example to work from in your own experience and being able to use it as an example for some practical application. What I'm going to do now is I'm going to drop very quickly your survey and certificate of attendance link in the chat. We did not just spend all this time talking about data evaluation for you not to fill out the survey, y'all. Okay. That's how we collect data. So I'm going to ask if you would please ensure to fill out the survey that is part of our data collection process. We're so grateful to you. So grateful to, I know many of you do attend the trainings, and we're grateful for that. We can't wait to see you again. And thank you all so much.